Yes. Okay, I think everybody's on.
All right, fantastic. Let me know when you're ready.
Ready.
All right. So I sent you all usernames, and there was a link with that, and it should have brought you to this page if you clicked on it. Once I log in, they're very easy transitions. Have any of you been able to log in at all to kind of look around?
Oh, yes.
Okay, cool. Now, my dashboard that pops up right here is going to be a lot different than what you have. But the main area you're going to focus on is this home health tab right here.
Yes.
So currently I linked myself exactly how you all are linked. And out of all of our patients that we are managing, you have 4. Do these names look familiar?
Yes.
Great. So I'll kind of give you a rundown of the screen that we're looking at right now. Obviously, you can see this is the patient name column. You can filter by the names by clicking this arrow, and it brings a drop down. You can type in the names by 3 letters. It doesn't have to be the entire name. Once you're done, you can either hit enter or click filter, and it will filter the name. If you want to clear that list, you go back to that arrow pointing down, hit clear, and it'll bring your patient list up again. The next column is your home health admission date. And I always tell our implemented home health agencies, the date in PMI could be a couple of days off of your technical start of care with the patient, because obviously we know you don't see the patient the same day they discharge. But this is typically the day of their discharge from their previous location.
Not our start date.
This column is the length of stay. This is how long that they have been under your service, give or take a day or two, depending on what your start of care date was. These are all the providers that are attached to the patient. Their PCP, any specialists, any community physicians are in here. Now over here in the risk track.
Can I ask a question about the physicians?
Sure.
In order of which is the primary physician?
I'm so sorry. I think the connection's bad. What did you ask?
I'm asking, when there are 3 physicians listed, is the first one listed the primary physician? Because
no. No.
Okay. Because I'm schizophrenic and I know he's ortho.
Right. No. So the next column is the risk track, and what you can do, certain assessments are filled out on these patients while they're in the hospital, and even downstream once they go through our care coordination team, and it will pull a risk on this patient, and that kind of gives us an idea of how many touches we need to do. So if you wanted to look just from your patient list, all you would have to do is see the breakdown of why that patient is a high risk. You can click on this, and it brings up what that assessment said.
It's great.
So the reason why this patient is a high is because of these 2 items, and so on and so forth.
It's very good.
So all of these pertain to the patient. And again, it's just by clicking on here.
Nice. That's very good.
The next column is the program details. You don't have to pay attention to this. This is more so for us, because as you can see, there are different program names. So this means New Vista Bundle, when the episode started, 4/27, when the episode is scheduled to end 90 days after, July 26th. There are 68 days remaining, and this was the episode initiator DRG. This is the DRG that was the cause of this bundle. But again, you guys don't have to focus on it, because every single patient that shows up on your list we have linked it to where you only see who we need you to see. Scrolling over gives you kind of an idea of how many admissions they've been, if it be the ER, hospital, home health, outpatient, and so on.
Will this show us who, like you saying there's so many 3 home health admissions, will that also tell us who they had maybe before if it wasn't us?
Yes.
Okay.
Yes, you will see all the notes that patient has through all users on them. You can also see, and I'll show you once we open up a patient, you can look at their locations and you can see the trend where they've been in the past for as long as we've had them in the system. And then over here, just kind of, obviously the home health name, it's you guys, their insurance, which Medicare, and the last completed note on this patient. The note urgency and who was the user that last completed the note.
Okay. So that would be, that could hypothetically be Morse Life Home Care putting in the last note?
Absolutely.
Okay.
So I'm going to open up a patient. Now, a good practice to have when you want to kind of transition from page to page, this patient list, I don't want to have to click on it again. So what I do is I click, I right click, I open link a new tab on the patient's name. That's going to bring me a new tab up at the top. Now this is the edit patient detail screen. This gives you their general details, their locations, risks, notes. Up here kind of gives you their date of birth, their current location, just lets you know a little bit about their general details. If you scroll down, like it said on the patient list, the length of stay, but here are all the notes. Again, it's the edit patient details screen. You scroll all the way down, and here are all the notes. You can scroll over to see who created the note and when. And this is going all the way back from when they were staying in the SNF. So you'll see hospitalization notes if we have a hack in the hospital documenting on them. You'll see SNF notes, and you'll see our community care coordination notes, which are by our community care coordinators, who are nurses that are remote and calling the patients. Now, if you wanted to go in and add a note, all you do is click Add New. We do ask that there are weekly updates on the patient, whether it's a general note or one of these. General note, a general assessment. This weekly update questionnaire is actually the best to use for your weekly updates. And it's very small. It's just this, and that's it. And then down, we always like to put a little comment box if you want to add anything else to it. Once you save this, and always remember to save, everything will show up here. All the comments will be here, but all the other answers you won't see unless you hit this edit view icon. So once you hit that, you get to see the answers. Now, no other users can edit someone else's assessment. You can only edit your own. Some other notes: if a patient goes back to the hospital, rehospitalization note. That's if, let's say you're at the patient's house, they need to be sent to the hospital, you would just put this note in. Once you hit the send to hospital and you put the hospital name, an alert is sent out immediately. And speaking of alerts, I should have gone back to the other. Anytime you need an intervention, you need someone else to step in. Let's say the patient refuses home health, but you can see clearly in our notes that we've built a relationship with this patient. You would reach out, you would put in an urgent note, which all it could be is a general note. You know, type in here, patients refusing home care, et cetera, note urgency, high. Because when you send a high urgent note, that means that you are needing someone else to step in. All the other times, they don't need to be high unless you are needing someone else's assistance. So if that were the case, what we would do is we see these high urgent notes, we read your note, and then we contact you. And if you need us to contact patient, we will. Do you have any questions on the notes before I go to the discharge details?
Is it possible that a dummy file can be set up so we can just kind of improve our expertise with this? Because every new program, sometimes there are little bumps.
Oh yeah, I'll set you guys up with, we have test patients that you can play with their locations and notes and assessments and their discharge dates, absolutely. That'd
be great, thank you.
Yeah, no problem. Let me write that down as a reminder, just a second. Okay. So our next topic is the discharge location details. When they are no longer under your service, all you do is you just go above the notes section, which is right here, the discharge location details. Next location, we'll say it's home with self-care. You just click this drop down, select home with self-care or outpatient, whichever they decide. Then agency name. Even though it is home with self-care, we have to put that in twice. So agency name will also be home with self-care. Another large drop down because we have assisted livings technically listed as the home with self-care. So that's why there's so many. Once you bring that drop down, you just start typing. Then up here, the home health discharge date. I'm not going to click it, but because what this does is once you put that discharge date and that date does roll around, it will automatically take them off of your patient list. And it will show their next look, and it will show their current location as the home of self-care. Now, if they do go outpatient rehab and that rehab is not in this selection, just send me an email and I'll send you another one of our contacts email to ask that we add it, because we can add it within minutes. And then what we'll do is we'll go ahead and go back to this patient. If you give us the name of the patient, we'll go and we'll update their location for you. So also with, like I said, a good practice with opening up a new tab, because what I can do now that I'm done with this patient, I would click save and continue, and I don't have to click this patient list and make it load. I can just click the tab up here, and there's my, well, that's a different patient list. I click the tab up here, and then here's my patient list. So I don't have to keep refreshing.
So Stephanie, let me ask you a communication question. If we are responsible for a 90-day episodic time frame, and we discharge a patient in 31 days and they're discharged and they come off our list, how will we know what's going on with that patient for the next 60?
You won't. They will be off your scope from PMI, because they're no longer under your service.
Okay, so the discharge date that we put in your system, does it have to be the date that we discharge them for Medicare?
It'll be the date that they are no longer receiving services under you, that you're no longer coming to their home.
Okay.
We're asking because we provide grant services.
Well, we're asking
You provide
programs in place just to keep the patient out of the hospital for the days that, even though they're not under Medicare. So.
Oh, okay. I didn't know that. All right.
We'll provide free aid.
So, yeah, so we can, so we'll just make the discharge date when we are no longer providing those programs. It's not necessarily.
Yeah, absolutely. Yeah.
Okay.
So they can stay even when Medicare is done and you're providing the grant services, they will still stay under your patient list.
Perfect. Okay. We could just make a note, though, to let you know they're off Medicare if you wanted.
Oh, you know what? That's a really good idea. Okay. If you put in a general note when the patient stopped their Medicare services, that'd be great.
Okay.
So something that's really important is once you are done documenting a note, just kind of get in the habit of clicking the save and continue up at the top. That will keep you on the same page. If you click save, it's going to take you back to the patient list. So save and continue throughout each. So whenever you guys log in and you look at your test patients, you can kind of play around, click on some of these. So providers. If you go to this provider tab, this gives you exactly what providers like we showed on the patient list, but it also tells you their type, and if you need to add any, all you have to do is click add new. If there's maybe a specialist that we didn't have on there that you know of that they went to see, you can add a specialist on here by clicking add new, and you start typing in the patient name and their provider type, specialist.
Do you guys keep up with the PICOs? You know, for the physicians need to update that PICOs every now and then. We just ran into an issue with that. Does the system automatically update that, or do you guys even care about that? I mean, just to question Medicare.
I haven't on our end out in the community, but I mean, if it's a physician, well, no, not so much. I can ask Sean more about that, but I've never really. That hasn't been under my scope at all.
That's okay. It is for us. I just didn't know if you did it on
for orders.
Yeah.
For order purposes.
Yeah. Because you
they signed the orders and their PICOs weren't updated.
That's what happened. Yeah.
Yeah. I think that might come more from the PCP office or specialist, whoever signs the orders.
Yeah.
But I mean, if you're ever needing our help, you reach out to one of our TCCs and I'll send you a list of our transitional care coordinators. And, you know, we can always try and calling the PCP office as well.
Okay. That'd be great.
Yeah. So if you wanted to see if we set up any appointments or if you yourself set up appointments for this patient, you'd go to the appointments tab here. So this shows me that this patient had an appointment with Dr. Grandick on the 9th.
This is great.
At 8:15. And that was put in by one of our hacks who is at the hospital.
Now, can we get visit notes from those when we know the doctor is seeing the patient? Can we get a copy of the visit note? We put in a request for that somewhere?
Oh, a copy of the visit notes from the doctor's office?
Yes.
That actually, we don't get those. unfortunately.
We know,
We know they're going, so we could call the office and ask for it at least.
That's what we do now.
So if you wanted to add an appointment, you would just, again, click Add New at the left corner. Type in the provider name. Appointment type, I know it seems like a lot, but we usually just use initial PCP follow-up or follow-up, whichever you want. The date of the appointment, wherever there's a red asterisk, that has to be filled in and before saving. Location, if you don't know the exact office, we sometimes type in office. And then you would save.
Save and continue.
Yes, yes, save and continue. General details gives the next of kin, if we have it, their home number, just their demographics. And if you see that it's wrong, you are more than welcome to update it. Now, locations, I know this will come in handy for you guys a lot. So by looking at this patient, they went to, you're going to see this. Don't be confused by it. This is how we initially loaded the patient in the system as Home with Self-Care Pop Health. So as of April 24th, I see this patient was in Bethesda East. Then they discharged to New Vista. And as of April 29th, they went to you guys. All right, so now I'm going to get out of this patient and I'm just going to X out at the tab up top. I'm going to go back to my home health patient list. So now this is going to be kind of a cool feature for you guys if the other users are utilizing it. This pre-admission list, this will let you know what patients you are expecting based on what the other users have put in to their discharge details. So let's say, for example, New Vista. So I'm actually going to open this patient up again because their screen looks just like yours for our SNF users with, you know, obviously a change of words. So what they would do is their next location, the minute that they put home health and more, and they hit save and continue, that immediately will send over to the patient pre-admission list. Now, you don't have it on your pre-admission list as of yet, but that will definitely change. If our hospital assessment coordinators know ahead of time, which that's going to be the roughest one because I'm sure, as you all know, that can change the drop of a hat from the hospital. So as long as they are putting this in the next location, these patients will show up on your pre-admit list.
Okay.
And those are your HUCs that are putting those in?
If they know ahead of time, but you're going to see it more so from SNF users.
Gotcha.
So like New Vista, yeah, if they know that they're going to discharge with you guys, that's going to show up on your pre-admit list.
Okay.
These are referrals from New Vista and Wellington?
This one is from New Vista. Let's see where all these are from. We already opened that one. This is Bethesda East. New Vista. New Vista. Yeah. I didn't see any, do you guys get referrals from Wellington Regional?
Oh, yeah, we do.
Oh, okay. So far I only see it from New Vista and Bethesda East, but that will increase. Oops, wrong page. Did you have any other questions?
So the data entry that we're doing basically is the HA weekly report. the discharge if necessary, any ER or any hospitalization, where if we cannot take care of the patient for some reason, the patient's refusing and we need somebody else to step in, we have to click on something, the patient's high. That's when the patient's high risk. General notes, but
Emergency high, right.
Emergency high risk, high urgency. And then, so how do we get alerted when there's a new admission?
That is a very good question. So I'm going to send you all a list of available alerts.
Okay.
That will be sent.
We have those.
Oh, you have those. Okay, great. So what will happen when the patient readmits to the hospital, whichever option you chose, you are going to receive it either in an email or a text or through a push notification if you downloaded the app. And I can't refresh my memory. Did you send me a list of what each of you wanted to receive?
I think we were waiting for the training today.
Yes.
Oh, okay. Yeah, sure, no problem.
There's a SNF admission. I don't think we need to do that, or the discharge. So I'm thinking the home health admission or a hospital admission.
Okay.
Hospital admission isn't necessarily our patient. So I guess, how would I know? So I want to know about So if it's a hospital admission, does that mean it's all your hospital admissions, not necessarily coming to us at discharge?
Only those.
Right. So you would probably want to receive, but you would know about a hospital readmission because if they're still under your care and you weren't aware of it and they go back to the hospital, then you'd get an alert. And that would give you a heads up. But you won't receive an admission because you're not attached to that patient anymore if they aren't under your services.
How would we capture if we had provided care and 4 months later the patient is back in hospital, and best practice for us to continue the home care once they're discharged?
So if we had a hospital assessment coordinator in that hospital, they would see your notes and they would look at the locations and they would see that they were previously with Morse Life.
So
and then they
for them to refer it back to Morse Life?
Yeah, so they would be the ones to suggest a case management, Morse Life.
Okay, thank you.
Yeah, no problem.
So I think on the dash or I think the home health admission, the rehospitalization, the ER observation, send to hospital would be good. We need that, I think. Okay. So there's hospital readmission and there's rehospitalization, but you're saying if it wasn't our patient, we would not get an alert on that.
Right, as long as your name shows right here.
Right where? Okay.
The current, as their current agency.
Okay.
As long as they're on your patient list, you will get whatever alerts that you would like on them. But once they are discharged from your services, you won't receive those alerts anymore.
Gotcha. So we'd want the pre-admission one too, though.
Yes, I can set that up.
Okay, I see 5 that we definitely need. Okay, so I'll send you those 5 for the agency.
There's more than 5.
And
Tina, wouldn't we want SNF admission and discharge? So if the patient had a path and they go from hospital to SNF, so we know what SNF they're going to. So then we can track them when they're discharged from the SNF.
yeah, we can do that.
Okay. Okay. Yeah. We
can talk about the list and finalize it before we send it to Stephanie.
Sounds good.
Perfect.
And then we'll just list our names and say if we want to be alerted via text or an email, right? Is that what
Yes.
you want the name? Okay.
Yes. Yep.
Okay. I will. I might have an issue, Stephanie, privately. I'll have to, is it you that I call or Sean on my login?
Oh, yeah, I can fix it. I can look into that.
Okay. So I don't want to waste anybody else's time. So are we done or do we have any more questions? This is
If
pretty
you guys have any more questions. Oh, I'm so sorry. What?
Just to give Tina or any one of us a heads up of how you're going to designate our tests so we can play with the website and become proficient.
So you will all see the same test patients. You're going to know it by seeing 3 Z's after the last name.
Okay.
good question.
So we
Yeah,
can
no
now
problem.
begin using this.
Okay,
So
so
I'll set up those test patients once we get off the phone.
yep,
So if they'll show up on your account in about 5 minutes.
beautiful. Okay, so and we'll get you that by the end of the day, the names and the alerts, and we'll do the test. And then what's the next step after that?
Once you feel comfortable, whenever a good timeline is for you to start, getting in there and documenting on the patient.
I'm gonna do it now.
If any of you feel like you may need extra time or help with any of the transitions through PMI, please feel free to reach out to me. That is not a problem at all.
Very good.
Correct.
All right. And then who was it that needed help with their login?
Me, Tina.
Oh, okay, Tina. All right. Do you want me to call you? What's a good number to call you at?
561-687-5766.
Perfect. All right. I'll give you a call.
Okay.
Get started.
All right. Thanks, guys.
Thank you.
Bye.
All right. Bye.